Welcome to part 2 of this daily 6-part series, Wendy Williams Health, Breaking Down the Illnesses. Make sure you subscribe to my channel and hit that notification bell so you'll know when I drop the next part of this series. I'm Dr. Frita. I'm a medical doctor who has been triple board certified, but I am not Wendy Williams' doctor, nor do I have privy to any more of her medical information than the general public. In the docuseries, Where is Wendy Williams? She and her family have revealed a lot of the medical struggles Wendy has been having. And so that's what we're breaking down in this daily 6-part series. Please be sure to check out part 1 from yesterday where we broke down lymphedema, Wendy Williams' feat. If you have not seen it, check the link in the description. Today is part 2, and we'll be talking about alcohol-induced dementia. Also, go ahead and click that like button and share this video with the people you care about because I'm about to give you some good information. All right, part 2, alcohol-induced dementia. A couple of days prior to the docuseries being released, Wendy Williams' team revealed that she had a diagnosis of frontotemporal dementia and aphasia. But in the docuseries, her son, Kevin Jr., shared that he had been told that she has alcohol-induced dementia to his recollection. So let's talk about it. It is very clear from the documentary that Wendy is suffering with an alcohol overuse problem or an alcohol addiction. And alcohol-induced dementia or alcohol-related dementia is when a patient gets dementia due to long-term excessive use of alcohol, and it causes neurologic damage and impairment of cognitive function. We definitely see some signs of that, but how do you know if it's alcohol dementia or if it is that frontotemporal dementia that her team says she has? Make sure you also tune in tomorrow because for part 3, I'll be covering frontotemporal dementia. So alcohol is not only a neurotoxin, meaning it's directly toxic to the brain. Well, it can also cause a vitamin deficiency, which can give you a Wernicke-Korsakoff syndrome. And again, you get signs of dementia. We'll get into it. Interestingly, alcohol-induced dementia tends to affect women more than men, and women will show signs even with lesser amounts of alcohol intake than men. So signs and symptoms of alcohol-induced dementia may include damage to the frontal lobe, so you have a loss of inhibition. You can lose the ability to plan or to carry out executive functioning. Like you might lose your ability to organize your daily calendar, to write a check even. You may develop inappropriate behavior and you have a lack of care about the consequences. You could care less if you're rude to somebody or if you call someone a name like calling them dumb or body shaming them. And yes, we did see some things in the documentary which could be consistent with these signs of alcohol-induced dementia. You may experience memory loss. And we saw in the documentary that Wendy Williams forgot what the Oscars were. Again, I'm not her doctor. I don't know officially what her diagnosis is. You may also lose the ability to carry out simple tasks like getting yourself dressed in the morning. You can have an impairment of language. So you can also develop some psychiatric problems like depression, change in personality, psychosis. You can have a disconnect from reality. You can also experience anxiety. There's also a form of encephalopathy that can be related to alcohol overuse called Wernicke-Korsakoff syndrome. And this is due to a vitamin deficiency that can be associated with the excessive alcohol use, vitamin B1 or thiamine, and it can cause memory issues, problems with language, cognitive impairment as well. With the Wernicke-Korsakoff syndrome, however, repletion of the vitamin B1 can help to reverse some of these neurological symptoms. So narrowing down someone to having alcohol-induced dementia can be really tricky because a lot of the signs and symptoms do overlap with Alzheimer's dementia and with frontotemporal dementia. There are some DSM-4 criteria for alcohol-induced dementia, and that's the gold standard, the Diagnostic and Statistical Manual of Mental Disorders, 4th edition. But even still, these diagnostic criteria are not really widely accepted because it's so subjective. Now, one key thing that would be important for someone to be diagnosed with alcohol-induced dementia would be the long-term excessive use of alcohol. And again, that definition can be subjective because different people can have effects at different levels of alcohol. But one criteria that has been suggested would be if a person has had a continuous use of excessive alcohol for at least 5 years, and some define that as 35 drinks per week for men, 28 drinks per week for women. This is very excessive. And if you want to know what is considered to be an acceptable amount of alcohol use, although I have to say, I can't in good faith tell you that any amount of alcohol use is actually good, but check out my YouTube video, How Alcohol Affects the Body. I will share some dangers of alcohol that will leave you speechless. Click the link in my description. Also, in order for someone to be diagnosed with alcohol-induced dementia, you should be seeing these cognitive changes after the person is sober. Certainly, you can't make the diagnosis while someone's intoxicated or while someone is going through withdrawal. How do you prevent alcohol-induced dementia? Drum roll, don't drink, okay? Or stop drinking. How do you treat alcohol-induced dementia? Well, depending on the level of the brain damage, some of the effects may be irreversible, but it has been shown that for people who stop drinking alcohol completely, some of that cognitive impairment, some of the memory loss can come back when it is alcohol-induced dementia. So yes, Wendy Williams' son did share that he was told, to his recollection, that his mom had alcohol-induced dementia, which is differing than what the team says. Because yes, they said that she has frontotemporal dementia. But don't worry, stay tuned for tomorrow's part 3 edition of the Wendy Williams Health, Breaking Down the Illnesses, because I will go into frontotemporal dementia and we'll compare and contrast it to the alcohol-induced dementia. Make sure you subscribe, hit the notification bell, like this video, and share it with the people you care about. I'm Dr. Frita, and I'll see you tomorrow.